nogen bliver på engelsk, fordi de er fra London af. Og de vil fortælle lidt om Helix Center, som er et projekt, de har været med til at starte i London, som er et samarbejde mellem Imperial College, St. Mary's Hospital og Royal College of Art. Og de vil fortælle lidt om deres strategiske og både deres designmæssige tilgang til, hvordan de arbejder med de projekter, de laver. Og når de har snakket færdigt, vil jeg give 2 minutter, hvor I lige kan snakke sammen. Finde ud af, hvad I snakker sammen om, hvad I har hørt, og måske lige komme op med nogle spørgsmål, I kunne stille, og så tager vi 15 minutter spørgsmål og svar. Okay.
Cool. Thank you.
Thank you. Can you hear me okay?
Oh,
Yeah.
Just speak.
Okay.
That's for the live stream.
Okay, cool.
So that won't matter for these guys.
Okay, cool. Hi. Right. Hi, everyone. It's lovely to see all your eager faces to learn a bit more about us and what we do. So I'm Rachel. I'm one of the designers at Helix, and this is Anne, who's business lead at Helix. I'm fairly new. I've been there for like a month and a half, by the way, so bear with me. So we want to do like a brief introduction about each of us first, so you can kind of get a gist of our really varied backgrounds. So I'm Scottish, and I went to the art school, the Glasgow School of Art, and did product design, which was very industrial. But in my time there as well, I went to Pratt Institute, which is in Brooklyn, New York City, and to do, again, industrial design there. So at the time, I was so keen that I'm a furniture designer. And I think that was quite typical as well when you're in that kind of environment. You're either a furniture designer or you're completely something else that no one really knows what it is. So naturally, I was like, yep, furniture design, that's what I want to do. And my first work experience was working for a company called Beau Concept. And I went and lived in Valencia for about 9 months, designing furniture using 3D software, which was amazing. I loved the software, but I hated what I was doing, and I hated the furniture I was designing. So I quickly came to realize it's not really my bag, and it was much more about the people that actually got me really excited, and not necessarily the objects that you sit on. I do appreciate it, but it's about behaviors that I was really into. So naturally, came back to Glasgow, did freelance for 1.5 years, working in Glasgow University Hospital in a neonatal unit, so changed quite a bit, and that turned into much more of a service design position. And I was like, this is absolutely incredible, this is what I want to do. I love the methodologies, the way of thinking, everything. And then I quickly started to realize I wasn't making anything, so funnily enough, full circle, wanted to try and actually create things to see what I could better in that service, scenario. Basically just realized what if I needed to learn those skills to know how to deliver and implement change, which wasn't possible at the time where I was, because it was just me basically trying to redesign a neonatal unit, and I had no money and I didn't have any connections. It's not the best situation. So then I went to a company called Think Public, who do very similar work, and they work with Dementia UK, Alzheimer's UK, Diabetes UK, like most of the main charities and organisations. And again, I loved it, but I found exactly the same situation. Wasn't making anything, was handing over loads of research and kind of going, here's how you're going to change stuff, and then nothing happened. So that's when I realized I needed to change industry, and digital kind of came up, and I got really excited about the idea. So I basically retrained at a company called Fjord, and did internships there, and then got a full-time position as an interaction designer. But it wasn't quite the right environment for me, so then I ended up going to a company called Us2, and I was there for 5 years. And there, not only was I doing interaction design, but it was pretty small when I joined, so I was doing a lot of the operations side of things as well, with how Us2 runs as a business. So looking at things like personal development, events, training, everything like that. So taking all of those skills, I kind of got to the point in my career where, again, working for a very big clientele, exciting to a point, and there's only so many applications you can make for things like Sky, BT, And the agency sort of side of things kind of took its toll, and I thought, now's time for change. And that's when I discovered Helix. So that's where I've ended up, and it's been amazing. So yeah, I'll pass on to Anne.
Let me just grab this guy.
Like
awesome. Is that good? It's not too much for... Okay, cool. Hi, everyone. I'm Anne. I've been at Helix for just about a year. I've got a very different background to Rachel. We have some common threads, though, which I'll talk you through. So I started off, I went to Boston University undergrad, and I studied supply chain. So I did business school once. I actually then went into finance. This was right around the time the bubble was nearing its peak. I think some of the air was starting to come out of it, so finance was like the place you had to be. I worked at Goldman Sachs in New York for 4 years, started off in the back office. By the time I actually walked in the door, actually my arrival at GS correlated with a very steep decline in the stock price and the stock market as a whole in the world economy shortly thereafter. It's not me, I swear. But yeah, I do have a pretty poor record of showing up to public companies and making their stock price drop. But yeah, it started off I started off in a back office role, and it was actually really exciting. We were cutting costs and trying to figure out what we could do, literally what we could throw off of the ship to prevent it from sinking, essentially. So it was great, a lot of fun, a lot of excitement. Once the markets kind of came back and things were a little bit less scary, that role became really boring. It was no longer, fighting for your life. It was creating reports for people that didn't really need to be done and were never going to be used. So I moved from that into a sales role, which was interesting. So selling essentially asset management products to pension funds, sovereign wealth funds, universities, and things like that. I took a lot of the analytics and data modeling stuff that I learned and applied it to sales, which was quite fun. Still wasn't convinced that finance was it for me. I looked around and saw someone who was, mid-50s at the same Monday morning meeting that she'd been at for 30 years, and I thought, I don't want that to be me. Didn't really know where to go, so when that happens, you just go to business school. So that's what I did. I went to London Business School, moved from New York to London, which was another thing that I'd wanted to do, and took that opportunity to say, okay, what else do I want to do? Initially thinking I'll be a management consultant, that sounds great, and then very quickly, before school even started, saying this is not right, and actually settled on tech. And I was really targeting the big tech companies, Facebook, Google, LinkedIn, and Amazon. I ended up at Amazon, as you can see in the middle there. That's one of the fulfillment centers. And again, my background in supply chain was like, okay, great, Amazon's a great place to do this. In the end, not quite right for me. I'm sure you guys have read all the stuff about Amazon. It can be a very fun place to work. My team and the product that I was selling was just not fantastic. While I was in business school, I got very involved in the healthcare club. I'll be completely honest with you guys. You're really encouraged to join clubs when you go to business school, and I procrastinated, and I missed all of the deadlines. And the healthcare club also were a bunch of procrastinators, and they had the latest deadlines. So no joke. I joined to help them run their conference, and then ran the following year's conference. And in that process, really had to dive in and learn a whole lot about the industry. We made a focus on kind of startups in health. So really dove in, got to know a lot about it, got to know a lot about the issues in healthcare too, and there are plenty. So that became interested in that. I did an internship at Johnson & Johnson at a very kind of forward-thinking innovation unit there. Ultimately, I had to choose between Amazon and J&J. And I stuck with Amazon. It was the first choice I made, so inertia had kind of set in. It would have been difficult to kind of unwind that deal. But also I thought, I've studied supply chain so much, and I really like it from an academic perspective. I think similar maybe to Rachel's furniture experience. So I thought, let me go and work in it. And the work in supply chain was not good for me. It's much better in theory than in practice, was what I found. So made it just over a year at Amazon, and looked around and happened to find Helix. And I thought, I read about it and I thought, this is fantastic. What is the catch? I couldn't quite figure that out. And our tech might be a little bit less state-of-the-art than Amazon's, or a lot, but it's been a great move. So I'm getting to apply some supply chain, some kind of P&L management responsibilities to Helix. I do business model design and try and help the team flesh out whether it's an idea about bowel cancer or about asthma, as you'll hear about in a minute. How is this going to work? You know, is there a commercial model? Sometimes there isn't in health in some of the things that we do, and that's fine. And how do kind of all the projects we do fit together to form kind of a whole thing and make all of Helix sustainable. So I'll take you through a couple of projects, just two very quick overviews of two different things, and then I will turn it over to Rachel to talk more in depth about one big project that they're working on where she's one of the leads. So first, Helix, as Sarah mentioned, we are, just going to drop this for a second, we're a collaboration between the Royal College of Art, Imperial College, London, and we're based at at St. Mary's Hospital, which is part of the Imperial College NHS Trust. So affiliated with Imperial. And we are essentially a design studio based in a hospital. So this is our studio. It's a building. This is a little glass box that looks, fortunately, nothing like the rest of the architecture of St. Mary's, which is a mix of really nice, old, but a bit decrepit Victorian buildings that have been there since Victoria herself was on the throne. And then this lovely, what is this, 70s, 80s, who knows, building. It actually probably looks better from the outside than the inside. But what makes this different? So we've got a workshop as well. That's not in the glass box. That's up in the ugly building there, where we can build things. Helix has a lot of people with industrial design backgrounds. So the focus initially was, okay, let's have a workshop. Let's make things, physical things, where we can go and we can put them in place into use quickly. So we've got a workshop for prototyping. You can see this was making a piece of a hospital furniture. But what really sets Helix apart from other design studios is our access. This is one of our designers, Matt, the back of his head. He's in a multidisciplinary team meeting about cancer. So he's in there with everybody else in the room as a clinician. And that blue lanyard around his neck lets him basically get into all parts of the hospital and access doctors and patients. So this was for a project that we did about the cancer pathway, which I'll talk about. But again, the access that we have to clinicians, to all parts of the hospital and the healthcare system was really critical in our being able to actually do what we did. So how we work, we've got kind of two main ways that we operate. We've got what we call the lab, which is where we go in, we do design projects, we go in, look for a problem, frame it out, create a concept for a solution, build and prototype and test that solution, and then implement it. We also do a lot of education, so we'll have short courses in, so groups of people in, 10, 20 people for a couple of weeks at a time. And we're also doing a master's degree, which will start in the autumn, I think September, October. There's more information on the table with the pastries and the coffee. I've left some flyers and we're happy to talk about that. So again, trying to educate people, leaders in healthcare, about how to use design and design thinking to actually get to the root of the problem and create things that can last. And these two things fit together because we've got, on the education side, we've got people and ideas coming in, and again, really smart people, really good ideas coming in, people who are doctors, clinicians, frontline healthcare workers, but maybe just don't understand or don't know yet the principles of design. But they have all the experience and the knowledge about health. So they come in with a problem that needs to be solved. We teach them the design tools, and we can co-create kind of a product out of it. Once that product exists, we then have people who are boots on the ground who are really motivated to go and get that thing into place. So that's kind of how we've trying to create an ecosystem. It's still kind of in the early stages, but we're hopeful that that's the way it'll work. So I'll talk about two projects. The first one is about bowel cancer screening. So in the UK, there's a public health screening program. You get a kit in the post to do a fecal occult blood test. And you get this when you're 60 or so years old. It just comes in the mail with no warning whatsoever. You get this kit telling you to do 3 stool samples on 3 different days and send it in, and then they'll send you the results. Compliance to this test can be as low as 35% in low deprivation areas. So we set out to understand why. So bowel cancer is the second most common and third deadliest cancer in the UK. If it's caught early, and this test is actually quite good at catching it early, you can have almost a great chance of recovery. So we are trying to understand, why don't people do this? We went out, spoke to a lot of people who'd done the test, people who refused to do the test, and learned a lot about kind of what behaviors were going on. So this is the test as people were getting it in the post. You've got a lot of words. It says bowel cancer, Cancer Research UK. This test card here, you do a stool sample, and then you swab it on the card. Because it has to be done on 3 non-consecutive days, this card has to go in your freezer next to your food, which is not quite pleasant for people. And in the UK, there's very much the UK is a culture where people do not want to interact with their poo at all. So to tell people, okay, you have to poo and it can't go in the toilet, you've got to like catch it somehow. It's really, it sounds unpleasant enough, but so barriers were actually pretty obvious. And the design team was kind of like, okay, this is, there's some pretty clear things that we can do here. So among other things, this is just one snapshot of the things that we did. So we made kind of pictorial instructions, so almost IKEA style, here's a drawing of the best ways to do all this stuff. Less to read, less to say, I'll read it later, I'll do it later. This instructional leaflet also is flushable, and it adheres to the sides of the toilet, giving you no excuses not to catch your poo. And then very easy, you can just flush it away. You don't need to get too close to it at all. There's also a move towards a 1-sample test, so you don't have to keep it in the freezer, you don't have to do this multiple times. That's going to be rolled out in a more phased way. And we also included a QR code where people can go, they get linked to a website with a lot of rich media. They've got their animations, cartoons. Some of them make, kind of make fun of this poo catching process, trying to make light of the situation a little bit. Others just explain, here, this is why the screening is important. Don't worry, you haven't been sent this kit because there's anything in your record. Everyone gets it on their 60th birthday. Not the best gift, I know. But it's just to give people a lot more information than they can get in the post. The post, what they can send in the post obviously is restricted because obviously the more it weighs, right, the more it costs. So in trying to reach everyone and skimping on materials, actually the uptake was really low. So we said, okay, can't increase the cost, but we can link people to a website where they can access a lot more. Another thing that we looked at, as I mentioned earlier, was the cancer patient pathway. So most of the London hospitals have really, really poor patient experience ratings for cancer. We set out to find out why. Why was that? Because the outcomes actually were very good. You're more likely to survive if you're treated at a London hospital, but you'll hate the whole experience more than you would elsewhere. This might not work in the PDF, but essentially this is the care pathway as we mapped it out. So the designers went in. Part of why Matt was in that meeting earlier was to figure out, okay, what happens all the way from diagnosis through to recovery and surviving. And this, we actually have this printed out in our studio, and it's probably about the length of that table, maybe a little bit longer. And it's, smallish font. So it's quite a lengthy process. And what we found out, also we showed this to clinicians, the same ones we'd interviewed for every piece of this process. And they said, wow, I've never seen this end to end. The surgeon will only see the surgical piece. Everyone else, the chemotherapy and those guys will only see their little slice. So it was really eye-opening for them to see this whole thing. We kind of summed it up, if you will, into a tube map style, which is a leaflet. It is A3-ish, I guess, in size, just to give patients something to hold and look at while they're getting their diagnosis. I mean, the way that, and our designer sat in on several diagnosis appointments with patients, and they're just getting tons of information thrown at them. The first words they hear, and the only words they hear, are that you have cancer, and they hear nothing else, understandably. So the problem was that they couldn't reiterate to their family and to their people who were caring for them what was going on, what the next steps were. So this, it's actually a leaflet. that looks like that, and we've done them for a few different cancers. It's got information, very easy to understand, very concise definitions and information about what is the cancer, what do all these terms mean. The pathway below this, on the leaflet, there's a space to write your appointments and to write any notes or questions. So the next steps for this, it's in use, which is fantastic. The next steps are to digitize it in some way. Not quite just putting it online, but seeing what else we can do, what else would add value to patients as they're going through that process. I'll now turn it back over to Rachel and gently hand her this microphone so she can talk about asthma. I'll still stand here.
Hello. Still think this is going to amplify my voice for some reason. Look at the size of it. Yes, so so when I started at Helix, I got put into a project called Flute. And so the reason why I joined Helix in the first place was, one, for me to be able to know more about the healthcare system and apply my delivery skills and implementation in an environment like that, because I knew how hard it was before. And knowing that this group of amazing individuals were here, I was like, okay, this has got to happen. This is it now. So basically, the reason why I'm on Flute is it's all about kids with asthma, and very interesting topic that I knew nothing about. So great for me. My mum's had it her whole entire life, and I didn't even know. So yes. So yeah, with Flute. There's some numbers, big numbers here actually, which are pretty crazy. So 5.5 million asthma sufferers alone in the UK. I'm not sure what it's like here or other places, but it's quite dramatic when it comes to like schools, how it impacts their education, because they have to come out of school because they're having certain medication problems or even attacks. So that's a huge deal, and then obviously costing a fortune to the NHS. And yeah, exactly, 75% could be avoided. So a lot of people, which I'll go to in a bit more detail next, are going straight to A&E for help. So what this project is about is trying to empower people to make right decisions at home without obviously causing more danger. If there is an attack or things like that, then obviously they need care, but the 75% kind of indicates there's quite a lot we could possibly do. And yeah, unnecessary deaths, so yeah, pretty impactful. So this is currently where it sits, the fact that it's very poorly controlled. And I think, yeah, but it's actually quite moderate in the scale of things. And then very, very small amounts are actually controlled itself. So when you see the movement, yeah, basically this is what we kind of want to get to the point that it can be controlled throughout all different levels of your asthma. So, yes. And some quotations here. Basically, the triggers themselves seem to be one of the biggest issues, actually. And at the moment, I'm interviewing 12 families in the Northwest, which are based in the St. Mary's Hospital. And every one of those has no idea how to read their child's symptoms, which is pretty alarming, considering like some of their children have had asthma for, say, 3 years. Some aren't even diagnosed with asthma because they're too young. So, but they have all the inhalers at home. They have some sort of a sheet of paper to tell you what to do when things go wrong. So again, triggers is a way for us to kind of look into this and try and better it. So, yeah. So, yeah, looking at what's in the market, a lot of it's actually, well, pretty much everything is aimed at adults with asthma. And there's nothing out there that seems to be child-friendly whatsoever, but also, more importantly, child-friendly and family-friendly as well. The fact is that kids will depend on their parents, obviously, helping them through managing their condition from a very young age up until teenagers. So obviously what you can see here, it's extremely unattractive, wordy, and in some cases very clinical. So this is where Flute comes in. So Flute is an application. It's basically a digital asthma management plan. but it also works with a whistle at the moment, so I'll show you that in the next one. But the idea is that you have a set of challenges for the child to take their peak flow, which is using this whistle, so it's a separate device that they could use. Capturing the data in there, and also finding information about the environments around them as well. So just very simple features at the moment. This is the whistle. There's usually a bit of animation, which makes it look really cute. And this is a video of a kid, which I don't think will play. But what happens is that with the challenges themselves using the whistle, for instance, we'll take the dragon. This little boy here sees the dragon, and it tells him you need to blow as hard as you can for this length of time. So the little boy goes, blows it into the actual microphone part of the mobile phone. This is I think before the whistle came, actually. And you see flames growing out of the screen, and the little kid's like, "Wow, this is amazing!" And then but you have to keep getting to blow. And I think he blowed so much he was like spitting all over the application. But it just proves that it could be potentially a really fun way to engage children in capturing their peak flow. So Pathways is another part of Flute. This is specifically why I was brought in. So Pathways is basically, a massive piece of research to back up Flute and to make sure that it's implemented at the right time, in the right touch points, being interviewed with everyone that's involved in this system. So basically, the 12 families that I've gone around, not only those, I've also with that blue lanyard as well, which is quite amazing. You get access to patient information, all their A&E notes, GP notes, everything like that. And I actually work one-on-one with an amazing junior doctor, Sindhu. And me and her have been trying to crack down basically what's going on currently. Why are people not capturing any data or information about their child's asthma? Do they currently have an asthma management plan? The answer is no at the moment. So the whole 12 families never have received one in all times they've been to the A&E or the GP. Quite alarming. They do get a sheet of paper though after their experience, but it's usually about too late that they're having to go into hospital for assistance. And again, like, as you can see with the percentages there, it tells you pretty much what's going on. Like 40% are actually confident in managing them, but I would say confidence like with the lightest effect, purely because when you do start asking questions about this, like knowing symptoms and tell us about what happened this time, and is there anything that would indicate to you that you need to go to A&E or your GP? All of them would say, we'd just go to A&E as soon as possible, really, because we just don't want the hassle of dealing with it at home. So that's, something to look at. And also GPs as well. You get 10 minutes with your GP, and it's hard to book an appointment. So, that is a massive issue within itself, which goes into a completely different infrastructure problem. So, And we tried to whittle down who it is that we're trying to aim Flute and Pathways at. And so far, working with Louise Fleming, who we looked at ages 2 to 5, purely because at that time it's very difficult to diagnose, if at all. But they're going to nursery, they're going to schools where they're getting very, very ill all the time. And we're finding massive amounts of A&E admissions and readmissions as well, which is a huge problem. And then the 5 to 11-year-olds is, again, an issue, but much more about confidence for the parents, being able to treat it at home, whereas the little ones is a little bit more tricky. So those are 2 challenges to try and see what we can do within that space. Yeah. So Pathways is basically just a way of connecting Flute in the right areas, which is why we're interacting with people within the A&E wards, schools as well. Like, we're going to schools to check out what's their asthma policy there. Are there school nurses that are trained within this area? How do the teachers feel knowing that they're the ones that are going to have to administer this medicine, like give it to the child? When in need. And alarmingly, a lot of the schools are not very confident to do that. The child may know how to do it, But the fact is they would rather keep the inhaler away until the parent arrives for them to actually use it. So we need to do a bit more research into that, to why that's happening. So, but yeah, and then flute as well, like from Pathways, we've realized that all kids, I'm not sure if any of you have kids, but every kid we've spoken to has an iPad, and they all play loads of games. So not only mobile phone, we're thinking how can mobile perhaps be more aimed at the parents, and the iPad itself much more about the children, but again, how they sync together. So these are some of the desired outcomes. Obviously, cut down in readmissions, which are unnecessary. Giving parents more of a family, ease of mind really, and not having to worry about their child, what's happening in certain points within their condition. Obviously saving money, but at the same time, I think the biggest thing here is allowing kids to be kids and actually not have to get upset or concerned about when things happen, but just feel confident themselves that they can work through this with their parents, and that the parents themselves know what to do at certain points. I mean, if you go onto YouTube, it's quite amazing the amount of content available there of parents having, with children, their child, that's starting to go into an asthma attack or having problems breathing, and they're filming it all, walking you through everything, showing you all the physical reactions that happen, and everyone's calm in the situation. The child's there just playing on his iPad, like not caring, and yet you can see certain parts of their body reacting. So and looking at all those comments there as well, like you can tell that so many parents find that really useful. So it's just trying to open up that doorway and try and give some support as well. So it's not having to go to your A&E and your GP necessarily for something that's so basic. And how are we going to measure the success of it as well? So what we would like to do, the dream scenario would actually have a device that is integrated into Cerner and System 1, which is what systems run within the healthcare there. And so that every time you take a peak flow or put in some data, you will be able to go to your GP and everything's updated automatically, things like that. However, this is massively complex. There's lots of politics there. So that's a dream at the moment. We're working on it. But what we can do is we've joined up with Harrow Road Hub, which is an amazing place. I went there the other day, and it's just super fascinating. It's where everyone gets together from all around the different practices, and they talk about patients, and they try and diagnose them together. So they try and get help to say, listen, I've got this patient, they're suffering, what can I do to help? And it's just, it's amazing that I get to be in that room. So they're really up for us trialing it with all of their children that have asthma as well. So that's brilliant. We can put the device into their hands. Royal Brompton has signed up. I think it's actually 300 children that they're quite happy for us to test on as well. This is also using the external device as well, so to make sure it's clinically trialed. And just how we build the application itself, which is kind of something that I'm super excited about. There's all different ways, if any of you digital, there's all different ways for you to interact with your users through different mechanisms, algorithms, things like that. So I can't wait to get started, really. So, yeah. And I think... that's it. Yeah, so stay tuned for that. Yes.
Thanks, guys. So I think we'll have a few minutes to discuss, is that right? And then we're here for questions for 15, 20 minutes.
Yeah.
Cool.
I får bare lige et par minutter til at snakke sammen om 2 og 2, hvis I har nogle spørgsmål, og bare hvad I lige har hørt. Og så tager vi til 15 minutter, hvor I kan stille spørgsmål.
All right, there's a lot of information happening.
No, it's perfect.
Just leave that there and just check my phone.
Is that okay?